Hey everyone, my name is William Hui. I am a third-year family medicine resident at Stanford Healthcare O'Connor Hospital Family Medicine Residency Program, located in San Jose, California. Today I'll be talking about my project, Advancing Point-of-Care Ultrasound in a Family Medicine Residency Program. So we'll just jump right in. So POCUS is highly applicable in family medicine residency training, and interest is building. Reason why is, if we look at the statistics, more than 60% of ultrasound in medical schools have an ultrasound curriculum, as well as more than 50% of family medicine residency programs. However, POCUS training is not as well established in family medicine residency programs versus emergency medicine residencies. The three main barriers include trained faculty, discomfort with interpreting images without radiologist review, and limited access to equipment. Why is POCUS so great? There's so many applicable scans in family medicine that we can use ultrasound in order to reduce time to diagnosis. We can help improve our patient-physician relationships with patients, help reduce costs to the medical system, and improve patient access to care. And so our program adopted Butterfly. We're lucky enough to buy Butterfly IQ handheld ultrasound devices, made them available to each resident and faculty, and so we eliminated one of the three main barriers, limited access to equipment. However, there still needs to be a lot more work done to be built up upon the existing curriculum. So, in terms of my methods, I looked into reviewing the Butterfly IQ cloud, where we store all our images. That way we could see what the residents were scanning and so forth. Looking at various family medicine residency programs, POCUS curriculums, AFP, POCUS curriculum guidelines, and recent literature related to POCUS and family medicine. My 4 project questions include: how do we measure POCUS competency? How do we increase resident confidence and interest in POCUS? How do we make POCUS more relevant to the generalist population? And then, how do we evaluate residents' learning and curriculum efficacy? So, in terms of my results, focusing on the upper left-hand graph, third-year residents, this graph looks at third-year residents, second-year residents, and faculty, and the average number of point-of-care ultrasound uploads to the Butterfly cloud. And this graph shows that as third years, after about a year and a half, we have about 60 uploads compared to the second years and faculty. Resoundingly, all of us could upload more, within a year and a half. The most common scans, if we look at the upper right-hand corner, shows that OB and MSK are the most used ultrasound modality, followed by gallbladder, cardiac, soft tissue. On the middle 2 graphs, I interviewed the residents and I wanted to see if they were interested in the area of concentration. And resoundingly, more than 75% of residents were interested, as well as if the area of concentration mandated that they had to purchase an online curriculum less than $200. Resoundingly, also more than 75% of residents were interested. And then focusing on the bottom graph, residents still continue to have interest in learning various POCUS applications listed below. And so, how do we evaluate competency? There is this research paper out from the Stanford University with some of our IM colleagues, and they created this great table that looked at methods for assessing competency in POCUS, looking at self-assessment of knowledge and skills, multiple choice questions to assess knowledge, skill assessment, peer review, and longitudinal patient eval and review. What we have before is what's marked in black, the black squares. So workshop curriculum, we have 8 3-hour-long sessions where we focus on each organ system, cardiac, lung, shoulder. And then we also do real-time assessment of patients in clinical decision-making while in the hospital, medicine rounds and clinic. We scan patients. What I aim to do is focus on all the other methods for assessing competency in POCUS. So for self-assessment of knowledge and skill, multiple choice questions, I created pre- and post-workshop assessments. So that way, before each workshop and after each workshop, there's a way to assess what we know and what we don't know. In an effort to add on peer review of images obtained on real patients, we could utilize the Butterfly IQ commenting feature to discuss POCUS findings as a class and be able to decide what's a good scan, what's a bad scan. When looking at standardized checklists for evaluating technical skill, because ultrasounding is a very technical ability, one of our previous residents created proposed competency checklist for core competencies. And then how do we have periodic review longitudinally. I created a Hocus Pocus interest group this year where we hold image review sessions, scanning sessions, twice a month. And then what we could build upon is OSCEs and the practical examination in order to compile all this together. And so for part of our interventions, my first intervention is the pre and post workshop assessment quizzes, where I created quizzes on Google Forms for each topic, for each workshop. There's an easy version, there's a hard version, and I send it out 1 week prior, and then I send the same test 1 week after in an effort to see if residents improve and figure out how well our workshops are working. Number 2, creating the Hocus Pocus interest group, where we have a core group of residents who are interested in ultrasound. We meet twice a month for scan practice, POCUS image review sessions, and among the residents we rotate through and take turns leading these interest group sessions. Number 3, I created a POCUS master document. This is a one-stop shop for residents to find resources, high-yield resources, the Hocus Pocus interest group schedule, quizzes, just one place where residents, faculty are able to find all the resources that they need. I also created a document called the POCUS Clinical Questions for the Generalist, and this is a compiled list of clinical questions for point-of-care ultrasound with included sensitivity, specificity, likelihood ratios to see what are good exams for us residents to learn. Are there high-yield exams that we should all learn as a residency program? And what are some scans that may not be worth the effort? So these are clinical questions compiled. Number 5, formalizing use of the tracker on the Butterfly IQ Cloud. And this way, we will be able to track what each resident scans. And tracking is a very important portion of a successful ultrasound curriculum. Being able to have some place where we can implement image review, see if the resident is answering that clinical question, evaluating the technical ability and seeing if it's a good scan, if there's anything missing, and also seeing if there's if there is a formal scan that was done, seeing how that point-of-care ultrasound compares to the formal scan. Number 6, creating a POCUS pocket guide. So this is a white coat essential, creating a very tiny cheat sheet mini book pocket guide for all the residents with the help of many residents, and each resident received this POCUS pocket guide, so it's easy to reference material while they're scanning. And then lastly, my project culminated in creating an area of concentration where it's open to 4 residents starting from year 2 and up, and basically there is a total number of scan requirement. There's a ultrasound curriculum online requirement where we utilize the Global Ultrasound Institute course, which is created by the Contra Costa Family Medicine faculty, as well as other ultrasound experts that are focused in family medicine. In this way, we can identify the residents who are more interested in ultrasound, want to spend more time in honing their craft, and then also they have responsibilities in leading, serving as a resident lead in all the POCUS workshops. They need to come to the interest group more than half of the time, and also lead rotating teaching topics, as well as there's an academic project component. And so in conclusion, this is one proposed strategy in helping family medicine resident programs improve their POCUS training. And this is one resident-led method, but of course there are different methods out there depending on what resident programs are looking for. But hopefully this is one step in the right direction in an effort to improve our residency's point-of-care ultrasound training. And so in terms of limitations, despite the interest, despite all of this, we still desperately need trained faculty in order to have faculty review and QI and QA our scans. There's been creation of several fellowship opportunities around the nation, some of which come to mind. The University of South Carolina is one of the most oldest and point-of-care ultrasound primary care specific fellowship. There's been a lot of emergency medicine fellowships opening up spaces available for IM and FM applicants. UPenn has one, Ohio has one, OHSU has one for IM. And so point of care ultrasound residency, point of care ultrasound fellowships are starting to emerge for primary care. And what we can do as family medicine residency programs is start and continue that interest, because there's going to be, ultrasound is, I truly believe ultrasound is the future. And since there are so many students coming in with prior ultrasound knowledge from medical schools, we can do our part and continue that knowledge in order to help improve point of care ultrasound training in the family medicine realm. Here are my references, and thank you very much for your guys' time, and please let me know if there's any questions. Just a little bit about my future plans. I am going to do a primary care ultrasound fellowship next year over at UPenn, and so trying to advance and continue the point of care ultrasound training and continue medical education. Thank you very much, everyone. Bye-bye.